getting started shortly here. Is it on? We don't have the slides on this one. Let's see. 1 second, everybody. We'll give a few minutes to let some more people log on and this. Oh. Yeah, that's right. Can you mute me, Andre? I think I'm getting feedback. For just being patient with us as we are trying to figure out a few technical difficulties. Is that good? Okay, I can still hear feedback here. Let me say, I know why. Okay, perfect. That's why. Okay. All right. So yeah, so great start. And so next slide. So like I said, for attendees, we are going to be offering continuing education credits for this event that have been generously sponsored by Piedmont Healthcare and Cancer Pathways. And so again, if you are interested in receiving these credits, be sure to fill out part 2 of the survey at the end of the event. All right, so before we get further into the program, I'd like to just start with this question, which is, have you known or do you know someone impacted by cervical cancer? And so for the people online, you can just answer on the window that pops up on your screen once prompted. And for those of us in person, if you just want to raise your hand if you've known anybody impacted by cervical cancer. So perfect. I have this. So that was a vast majority of the people in the room have known or know somebody with cervical cancer. And perfect. Give another second here to allow the online responders. Perfect. And again, about 76% of our attendees online have known or know somebody who has been impacted by cervical cancer. So thank you. And we can clearly see the broad impact that cervical cancer has throughout Georgia. And so a big thank you for everybody for taking time out of your busy schedules today so we can join together and raise awareness about an issue that, that we are all concerned about and important to us all, which is cervical cancer. So I am going to move to the side real quick and let's see, yeah, perfect, thank you. Trying to clear our screen here. Again, apologies for the technical difficulties. So I'd like to give a big thanks to our sponsors today. And my name is Brian Boyce. I'm one of the co-chairs of the HPV Cancer-Free Georgia Work Group, along with my distinguished co-chair, Astrid Wilkie-McKellar. And so our work group is devoted to increasing HPV vaccination throughout Georgia through increased education and advocacy. Next slide. Oh, and there's our sponsors there. So thank you to Georgia OBGYN Society, the American Cancer Society, our Hispanic Health Coalition of Georgia, Cancer Pathways, and the Augusta University of Georgia Medical Partnership. We would not be able to do this without your partnership and sponsorship. And so there are some tables around, and we would just ask that everybody who's here at the in-person event, please visit some of those tables if you're able. So here is the agenda for us today. We have an excellent lineup of dynamic speakers and of experts in the field of cervical cancer and HPV vaccination. So we're really excited to hear them talk, and we'll get right into it. And since we are back at the Georgia State Capitol, it would only be appropriate to have Representative Terry Anulewicz be our first speaker. So Representative Anulewicz has been a staunch supporter of our Cervical Cancer Awareness Day for many years now. She has been a strong advocate for issues impacting women's health in Georgia, and she routinely addresses the legislature here in Georgia regarding issues and is actually sponsoring a resolution in the House of Representatives to officially recognize today, January 19th, as Cervical Cancer Awareness Day in Georgia for 2023. So we're really happy that Representative Anulewicz could be with us today. And so without any further ado, I'll have her come up to the podium.
Thank you. Hi, good afternoon, everyone. I am so proud to be here again. This is, I believe, my 6th Cervical Cancer Awareness Day here in Georgia. And as you're aware, the legislature is not in session today. We're hashing out the budget, but that is actually probably much more relevant to what all of our goals are in this room right now than when I make the announcement about Cervical Cancer Awareness Day from the floor on Monday morning and share the latest statistics with my colleagues. Because every year when I do that, people say that they're amazed. And I've had people say to me again every year, "You mean there's a vaccine for this?" I'm like, "Yes, there is. Both of my teenagers have had both of their doses. It's very important. You know, it's key." And so the resolution, and you'll recognize this if you are a repeat participant, but it's recognizing and commending the Georgia Cancer Control Consortium as part of the Georgia Department of Public Health, HPV, Cancer Free Georgia, Cancer Pathways, the Northwest Georgia Regional Cancer Coalition, and the Susan Jolly Awareness Program for their exceptional contributions to cervical cancer education and awareness in Georgia. Whereas January is designated by the United States Congress as Cervical Cancer Awareness Month, and whereas the Georgia Cancer Control Consortium, HPV, Cancer Free Georgia, Cancer Pathways, the Northwest Georgia Regional Cancer Coalition, and the Susan Jolly Awareness Program are dedicated to HPV and cervical cancer awareness efforts in Georgia. And whereas in acknowledgement of their important work, Georgia Highlands Medical Services Cumming, Wellstar Pediatrics Avalon Health Park, Affinity Pediatrics Moultrie, Memorial Health Meadows Physician Children's Care are recognized as the 2023 HPV champions. Whereas cervical cancer is the 4th most common cancer in women worldwide each year. And this was part that was a little bit hard because the numbers have increased a little bit, but I do feel like what the data is showing is we're about to start seeing this decreasing as this cohort, this generation of kids who has had this vaccine grows up and does not get cancer, at least this kind of cancer. But whereas more than 14,480 American women are diagnosed with invasive cervical cancer, including 490 in Georgia, and more than 4,290 women die from this disease annually, including 140 in Georgia. And whereas 1 in 5 Georgia women lack access to regular screenings that can identify cervical cancer in its early stages, and fewer than 1 in 4 Georgia adolescents have received the recommended doses of the HPV cancer prevention vaccine. And more Black and Hispanic women get HPV-associated cervical cancer than women of other races and ethnicities. And whereas cervical cancer is one of the most preventable and treatable cancers due to the availability of screening tests and the HPV vaccine, in fact, 95% of all cervical cancers can be prevented by the HPV vaccine. And that's the point that I really like to drive home to my colleagues. Like, this is a vaccine against cancer. And we can't say that about many things. And it's not just women, it's men, it's young girls, it's young boys. I know of a woman in her 30s who's fighting tongue cancer right now that is an HPV related cancer. I mean, these are things that impact across the spectrum. So now, therefore, be it resolved by the House of Representatives that the members of this body recognize and commend the 2023 HPV champions, the Georgia Cancer Control Consortium, HPV Cancer-Free Georgia, Cancer Pathways, the Northwest Georgia Regional Cancer Coalition, and the Susan Jolly Awareness Program for their exceptional efforts and commitment to advancing cervical cancer awareness. And so we're going to have copies of this for everyone. But again, thank you for being here. Thank you for the work that you are doing and the support that you give to me and my colleagues. Thank you as we, again, just spread the word about this amazing vaccine that we have and at the efforts that we're doing to make sure that women are screened, that have this screening, because if you catch this early, it's so treatable, and it's so preventable with this vaccine. So thank you again for being here. Thank you for having me. And it's an honor to host.
Thank you so much, Representative Anulowicz. That just hit on so many important topics. The need for improved healthcare access to get these cervical screenings done, the importance of that HPV vaccine that not only will prevent cervical cancer, most cervical cancers, but also prevents 5 other cancers as well. So we really need to just convey that to everyone we meet and how important it is to get vaccinated. So next up, it is really my true privilege to announce our next speaker, one of our keynote speakers, Dr. Joy Baker. Dr. Baker is a physician and board certified in obstetrics and gynecology. She takes care of patients at Wellstar, West Georgia in LaGrange, where in addition to all of her clinical work, she serves in multiple leadership roles, such as chairwoman of the OBGYN department there, and also director of quality and safety in women's health. So we are really glad that you could join us here today in person, and we're really looking forward to hearing your talk.
All right, I'm gonna put my timer up here because if you give a girl from the Southern Baptist Church a microphone, anything's liable to happen. Thank you so much for giving me the opportunity to talk with you guys today. I want everybody to close their eyes, everybody on the web, everybody in here, and imagine with me a cervical cancer-free Georgia. What does that look like? Wonderful, right? So you can open your eyes and we're going to jump into this presentation. I just want to share some facts with you briefly. We'll go to the next slide. I have no financial disclosures. I say this at every talk I give, and I keep hoping someone will give me some money so I can put them up here, but they never do. And so after this presentation, I hope that we're able to understand the prevalence and disease burden of cervical cancer in Georgia. Our representative talked about those numbers, and those are very important for us to know and be aware of. We want to recognize that disparities exist in cervical cancer screening, prevention, and treatment. And these could be racial, regional, people who live in rural areas like I do, or educational. They just don't know what they don't know. And then we'll explore potential solutions for screening, prevention, and treatment. Next slide. So why are we here? Why is this even important? As our representative alluded to, probably she said 14,000, which might be an updated number, but lots of women are getting cervical cancer every year, and about 4,200 of those women are going to die. And in 2021, our statistics showed that 140 Georgia women died from cervical cancer. And so we know that this disease, cervical cancer, is 100% preventable. If you have the vaccine, that takes care of 95%. And if you're getting regular screening, that knocks out the other 5%. So this is something that no woman should ever die from. And it's also highest among women of color. And so we need to be very aware of this. Many times these folks might be screened, but for whatever reason can't follow up. So next slide. So HPV, or human papillomavirus, is the primary cause of cervical cancer, and it is common in both men and women. The people who are infected with HPV who don't clear it from their system using their own, healthy immune system might experience anal cancers, genital cancers, or even cancers of the head and neck. So it's very important that we are aware of HPV. It's a sexually transmitted infection, and so anyone who has been sexually active can potentially be can potentially have the HPV infection. So we need to be careful about that. And that is the one reason that we actually do Pap test screening, is because once you become sexually active, you can come in contact with HPV and get a lingering infection. We very rarely see mother to baby transmission with HPV. Next slide. So HPV is kind of a funny thing. So normally people are going to clear HPV with their own immune system, right? But as we age and our immune system is not as robust anymore, then HPV sort of can hang around. So women, particularly over 30, can be affected. And then we have women. So as women age, we start doing a little bit more screening. So at age 30, we usually start doing both the Pap test and the HPV DNA test. So cervical cancer on average is going to take about 10 to 20 years to develop. So if someone is getting routine screening, we should catch that, we should treat it, beat it, and move on. Next slide. So the cervix is all the way in the back of the vagina. And I talk to my patients about this a lot because there's a lot of, kind of, I don't know, it's mysterious down there, right? So people are not quite sure what's happening with their reproductive organs. So I describe the cervix as a mini donut in the back of the vagina, and that's where we're actually taking the Pap test from. It's the opening to the uterus. So it's kind of important to know the terminology, know what you're talking about. And so we'll move on to the next slide. So risk factors. Anybody who's been infected with HPV is certainly at risk for developing a cervical cancer or one of the other cancers we've already named. And not getting regular screening is another big risk factor. Because remember, we talked about the 10 to 20 year gap that's there. So if you're getting screened, we should be able to catch it. Illnesses that weaken your immune system. If you are a smoker, which we don't think about very often, but smoking actually helps HPV infect the cells of the cervix and cause the cells to become abnormal. So that's a big deal. We hear a lot about diet and exercise in many cancer preventions. And then, since this is actually a virus that's transmitted by sexual intercourse, then we have to be thinking about the number of sexual partners and whether or not we're using protected or safer sex methods. And then if someone is infected with one sexually transmitted infection, they can become infected with another more easily. So it's something to pay attention to. And then certainly poverty. We heard about how we can have some barriers to getting screenings and treatments. And so if you're not able to afford care, you may be in trouble. There are some folks who have family histories of many cancers, and so they may have a higher risk of cervical cancer. But remember, HPV is sexually transmitted. So this can come to, if you don't have a family history, you're still, going to be paying attention to that. And then DES exposure. And DES is a chemical that we used to use a lot of, but we don't really see that anymore because we have, banned that chemical. Next. So about 6 million new infections of HPV happen per year. And guess where they're happening? In our young people, right? So that's why vaccination is so important. Most HPV is going to be cleared by our immune system, but for those people who have lingering infections, that's when we get into trouble. And so those can become cancer in men or women, but most HPV causes no harm. Next. So how do we screen for HPV? In women, we screen with the Pap test, and there's also an HPV DNA test that can be done with that Pap smear. But guess what? There's no FDA-approved test for men, particularly men sleeping with women. So heterosexual men don't get tested. If men are sleeping with men, then you can actually do a Pap smear of the anus. But for most people who are male, there's no testing. So we have, men that may be carrying HPV who have no idea, and then they are, infecting their partners. Next slide. So the cost is expensive, right? So all of these doctor's visits, follow-ups, surgeries, just think about how many people are affected with HPV and how many people are going to have an abnormal Pap test. And we're spending in the billions on this, billions with a B. There's also a psychological cost, right? So this is a sexually transmitted virus. There's a whole nother set of stigma and shame that can be associated with that. Some of the exams are uncomfortable, having biopsies done, it's no joke. So we have to count that full cost when we think about what is this costing us as a state. Next slide. HPV does not discriminate, but healthcare systems do. Next slide. So recently, I got a really great opportunity to participate in a study with the Human Rights Watch and the Southern Rural Black Women's Initiative. And this research was primarily done in Baker, Wilcox, and Coffee counties. And we actually were looking at the question, what drives racial disparities in cervical cancer screening, diagnosis, and treatment, particularly for women who live outside of the metropolitan areas. And so these were the four kind of big points that this study showed us. One is that there's a lack of access to affordable care. And, we hear about these fights in the media about Medicaid expansion, but I would submit that it's more a matter of people than it is party. So no matter what side of the aisle folks are sitting on, we need to think about that, because there's a gap when it comes to insurance. There are people who are working hard who just may not have insurance from their employer, or they can't afford healthcare insurance in the marketplace, but then they make too much money to afford public insurance. So that's a big deal. And even for folks who are privately insured, it can be a big deal, because to see a gynecologist might be a $50 or $60 copay. And if you have you're coming in 3, 4, 5 times a year, that can get expensive for folks. And then, of course, another big one is the lack of GYN access. Over half of Georgia's counties do not have a practicing OBGYN. So if I get an abnormal pap, what do? So what happens right now is that the Department of Public Health is valiantly trying to help us bridge these gaps. So they're putting pap testing in a lot of the county health departments. But if someone comes back abnormal, then what? Then we have to maybe find a local gynecologist or a gynecologist as close to us as possible and see if they will volunteer to bring these women in and do these procedures. And so I volunteer in my county, and patients come in, I do the cervical biopsies. They have to take their little biopsy cup back to DPH to turn it in. And DPH has worked out another special deal with a lab that's going to look at it for them and then fax me some results. So can you see how that lends itself to error and loss of follow-up for that patient? So that's kind of what we're dealing with right now in Georgia. And then across the country, we just have a lack of OBGYNs. We're about 8,800 OBGYNs short across the country. So the other big point was that there was a lack of information about the HPV vaccine. Many people had never heard of it. Like our representative said, people always ask, oh, is there a vaccine for that? Yes. So we need some more information getting out to folks. And then people understanding the actual screening recommendations, which is critical. So that's a big part of the deal, because if you don't know what you don't know, you're not getting screened, you're not getting vaccinated, then you run the potential risk of getting HPV and cervical cancer. And then, of course, there's always the elephant in the room, which is the impact of racism and discrimination. And this can certainly lead to provider distrust. I was sharing with the study team that I had a patient that came in who knew she had an abnormal pap for 10 years. But she went to her gynecologist and she had an exam, and a student was invited in, which she did not consent to. But then the gynecologist saw a lesion on the cervix and proceeded to invite in 4 more people to look at it. She was mortified, and she just never went back. And she lived in a place where there was not good access to care. So that was the only gynecology office within 50 miles of her. So when I got her, you can imagine she actually has a tumor, right? But she just didn't trust, she felt violated, and she just never went back. And then, of course, there can be health system distrust. Next slide. So imagining a cervical cancer-free Georgia. Let's look at what that looks like. Next. No one dies of cervical cancer in my cervical cancer-free Georgia when I'm dreaming about this. We need to revive our reproductive health education in Georgia schools, and we need to expand Medicaid, y'all. I'm sorry, I'm just kind of blunt like that, but we need people to have access to be able to get vaccinated, to be able to get screened, and we need to make sure that that's across the board. We have to prioritize GYN care in neglected communities, and we have to have funding for special public health information campaigns, particularly those that are led by the trusted voices within that community. I can't tell you how many times we've thrown money at things and we think we're doing great public health work, but we're really not, because no one in Baker County knows me or trusts me. So why should they care about what I have to say, right? So it's got to be the people in the community with boots on the ground, and then additional resources for our Department of Public Health, who's trying to stand in that gap for us. We need to have that, and have some affiliated health centers that maybe the doctors aren't volunteering to take these patients. Because if you are a private doc in the rural community, can you really afford to volunteer for anything? No, you're barely keeping your lights on and your doors open. So the policies that are made here affect so many Georgians. And we got to think about how those policies that we're putting in place and that we're advocating for, how do those policies affect the most neglected folks, the most marginalized folks, the most vulnerable folks? So that's a serious thing that we always have to do. And getting those voices around the table in the room before we make decisions can be really helpful. Next slide. These are my references. So if anyone wants to check those out, feel free. And finally, this is my team. This is Team B. And they do such an amazing job helping me take care of Troup County and surrounding counties. We have 6 counties surrounding us that have no OBGYN provider. So these girls are busy and they do a great job serving our community with heart. I thank you so much for your attention. And I don't know if there's time for questions, but I'm happy to entertain them if you've got them. I think I have 2 more minutes.
So I am a survivor too, ovarian cancer. And when you were saying that the men can actually transmit that sexually, are they obligated? Well, obviously they don't know, right?
Right.
So I was going to say, are they obligated to tell the female that they would know because there's no testing for it?
Right. So they have no testing, but so the burden kind of falls on women to be tested. And then they have to tell their partner, you know, hey, you might want to, but we don't really do testing, and we don't do medication or anything for HPV. It's all up to your immune system to clear it. But if you have abnormal cells on the cervix, we can remove those and try to keep you from getting cervical cancer.
It was a great talk. Yes. I like the analogy of the donut explaining the anatomy. The mystification goes with education, the analogy, metaphors. You remind me as a pediatrician, I sometimes have to do the same. Break it down, and like, for example, intercourse. Where intercourse, some people don't know that intercourse is just not penetration. You can have oral, you can have girl to girl, vagina, right?
Absolutely.
Exactly. So they are to remove the words into
Absolutely. I love that. That's a great point. So I am very happy. I'll be around. So if anyone has questions they don't feel comfortable asking in the public forum, I'll be happy to get those later.
Thank you so much, Dr. Baker. That was such a wonderful talk. You know, very educational, touched on so many different barriers that Georgians face. I can't imagine anybody going through that number of steps to get those biopsies done. I appreciate the work that Georgia Department of Health is trying to do, but that's a lot to get done. And so next up, it is my privilege and honor to introduce our next speaker. It's a cancer survivor, Miss Lisa Sin. She will be joining us virtually today. And so we're going to have her turn on her camera and her microphone. So thank you for joining us today, Lisa. And we're happy that you're willing to share your story here.
Hello, can you hear me?
Yes, we can hear you.
Okay, awesome. My name is Lisa Sin. I'm a 58-year-old cervical cancer survivor. This has been a long journey just to get to this point. I started having, it was tremendous pain right before COVID set in. And so I had been sent to have my gallbladder checked, and there was a stone there. So that was what we were going to do. We were going to remove the gallbladder. COVID set in March, and that didn't get done. Well, my pain persisted to get worse. It was excruciating pain. And my health was deteriorating, you know, just from, I was just sick. And so I waited until December of 2020 and I started reaching out for help because I could just barely tolerate it. And you still couldn't get in with a doctor, so go into ERs and urgent cares. I was continuously having UTIs, and I had previously never had a UTI, and I was like, "What is going on here?" And I was my primary care doctor when I finally got in with her. She did a Pap smear and sent me to a gynecologist. The gynecologist um, told me he did ultrasounds inside and out of my vaginal area. He did an exam, did blood work, and he was like, "Whatever is going on with you, it's not here. You need to go back to your primary care and get her to see what else she can send you to try to get help." Well, when I was about to call her, she was calling me, telling me you got to call him back and let him know that you had an abnormal pap. Well, they were saying, no, no, no. The blood work shows you were cancer free. And I later learned that that blood work didn't actually pertain to the cancer that I had. Well, I finally went to ER in West Georgia, and Dr. Redwood sent me to a gastroenterologist because, like I said, the pain was just unreal. And they did a, a clean catch cath there, and there was no UTI present with that. And so I seen nurse practitioner um, Erin Spinks, and she started sending me, referring me to doctors there around in West Georgia. And Dr. Joy Baker was happened to be one of them, thank God. And she did a pap smear and it came back abnormal, of course. And she did a cervical biopsy, which showed that I had cancerous cells. After that, she sent me to Dr. Hines in Atlanta, and I was diagnosed with TB, cervical cancer, stage TB. I'm sorry. And from there, he sent me to Callaway Cancer Clinic there in West Georgia, and I went through five weeks of chemo and radiation. And after that, I had to go back to Marietta to Kennesaw, and Dr. Brown did radiation straight into the tumor. It was 5 rounds of radiations, 2 different trips, 3 one time and 2 the next. And after that, I was cancer free, but I'm having trouble with my kidney. I have to have lab work done monthly and see my kidney specialist once a month. I have to go because they have discovered that they did a bone marrow biopsy and discovered that I do have some precancerous cells. So I have to have that checked at the cancer clinic, my blood work uh, quarterly. And I see Dr. Baker quarterly for my monthly, my quarterly exam there because I can't afford to go to Atlanta because even though I have insurance not working and all the co-pays, it takes a financial toll. Um, and it's just, I hope that this will get through to people to let them know that these cervical cancer ladies really need all the support that they can get because their children, their aging parents, their families need them to be here and be healthy. And I appreciate you all listening to me and let me share my story. If there's anything I can do on my end to help get the word around about the vaccines, because as of course, I'm 58 years old, and so there was no vaccines when I was young, and I will be glad to do anything on my part that I can to help these people because, like Dr. Baker said, the there's no reason for people to be dying from it like this because technology and medicine is really too advanced for that to be happening. And thank you for your time.
Okay.
Are you,
Perfect.
are you
We're back.
speaking?
So I was just saying to the group here that it was just a very powerful story, and we're just so appreciative for Miss Sin for sharing that and being vulnerable, and that this really is truly a preventable cancer with the tools that we have currently. It's not something that we need new inventions or technology for. We have the tools right now to eradicate this cancer. And so next up, our next slide. Perfect. So along those lines, it's really, again, a privilege and an honor to be able to announce our HPV champions for 2023. So these practices were nominated by immunization coordinators from the Georgia Department of Health from all across the state. And so what they got nominated for is their excellent work that they have done in vaccinating patients against the HPV virus, the virus that causes 6 different types of cancer. So I'd like to recognize the Georgia Highlands Medical Practice, Pediatrics. They're located in Cummings, and they were nominated for having 82% of patients in their practice having received their first dose of the human papillomavirus vaccine, and 62% having received their second dose. And then in Wellstar Avalon Pediatrics practice, that is a practice led by Dr. Lewis and Dr. Prankun. I know that they wanted to be here. I know that all of the practices wanted to be here today, but we're just unable to do it due to prior commitments. But they had 81% of their patients vaccinated with the first dose and 63% for the second dose. Affinity Pediatrics is located in Moultrie, Georgia, and that is a team led by Dr. Randy Tatum. And they had a whopping 91% of their patients vaccinated with the first dose and almost 80%. They had 76% having received their second dose. And then last but certainly not least is the Memorial Health Children's Care, which is located in Vidalia. And that's led by Doctors Masterman Smith and Dr. Pittman. And again, outstanding numbers, 89% having received their first vaccine and 71% having received their second dose. So again, just a reminder, it is for the recommended age range 9 to 14. It is a two-dose regimen. And it's important for boys and girls to get this vaccine. Like Dr. Baker was saying, it affects men and women cancer. So throat cancer, tongue cancer is most common among men, that is HPV related, and the cervical cancer caused by the HPV virus is the most common in women. So again, congratulations to all of the HPV champions this year. We do hope that in subsequent events that we will be able to have you all participate, and we just look forward to that. And we just appreciate all the work that you all have been doing to eliminate the 6 cancers that are caused by the HPV virus through improved vaccination. Next. Yeah. All right, and so next up, we have our second keynote speaker, which is Dr. Ashley Hannings. So she received her doctorate of pharmacy from the University of Georgia and is a board certified ambulatory pharmacist. She currently works at the University of Georgia College of Pharmacy, where she works closely with pharmacy students as the associate director of the Introductory to Pharmacy Practice Experience, and also directs the immunization training program for new pharmacists. She is no stranger to our cervical cancer awareness events, and we are definitely happy to have you back and joining us today. Thank you, Dr. Hannings, for coming in.
Thank you so much for having me back today. I'm guessing that when you hear pharmacist, that's probably not the first healthcare provider you think of when you think of cervical cancer prevention. So I'm really happy to be here today to talk to you about how we might be able to help out and how we might be able to be a resource for both patients and other healthcare providers. Next slide, please. And before I get too far, I also have nothing to disclose, but of course, if you would like to find me afterwards, I will definitely consider taking your money. But our main objective for this portion of it is to describe the role of pharmacists and increasing community access to the HPV vaccine. Next slide, please. A couple just short facts about the current vaccine that we have available. It's HPV 9 or Gardasil 9. And the 9 is because it covers 9 different serotypes of the HPV virus. Now, there are a lot more out there. However, the ones that in this vaccine account for over 90% of cervical cancers that we see. So getting this vaccine significantly decreases your risk. And so it's very important. The FDA has approved it for ages 9 to 45 as a 2 or 3 dose series, depending on the patient. It's routinely recommended to give this at age 11, 12. And it's routinely recommended through the age of 26 if you miss that ideal window of opportunity. And then adults who are 27 to 45 can choose to get it if it might benefit them, for example, if they might be having new partners. I will mention that I know that there are some pediatricians who prefer to give it closer to age 9 in hopes that there's a better chance of being able to finish out that series. But routinely, 11, 12 is what we're looking at. Next slide, please. So how are we doing as far as this recommendation? So I pulled this data from the CDC's MMWR, and I wanted to look at over the last 3 years or so what these rates look like as far as are the patients who are eligible actually getting the vaccine. And there is good news in that we continue to go up in our vaccination rates. So just in the last 3 years, you can see an increase in the percentage of people who are getting vaccinated. Now, what I've highlighted here is for age groups 13 to 17. So keep in mind, ideally, we want to give it around age 11, 12. So this is a population that should have already been vaccinated, and we're still not quite where we need to be. So there's still room to grow, especially when you compare this to some of the other childhood vaccines that are given, like for measles. Those rates are often closer to 90%. So again, still a little room for growth, even though we are moving in the right direction. Another thing that I wanted to point out, if you'll click one more time, is that there is a little bit of a gap as well in those who get 1 dose versus those who complete their series. So that's something that we need to think about as well, and making sure that there's some kind of plan for follow-up so that someone can complete the series and get the full benefit of that vaccine. Next slide, please. So where do we come into this picture as pharmacists? So I think, just a few years ago, there wasn't as much awareness as far as pharmacists being providers of immunizations, but I think the pandemic has actually really brought us to light with the role that we played in the rollout of the COVID-19 vaccine. But one of the things that kind of makes it tricky as far as how involved we are is that the pharmacist's authority to administer vaccines varies by state to state. So that is something that is governed by state law. So it's that law that determines what age the patient can be for us to vaccinate them, which vaccines we can give, and how we can go about giving those. And what I mean by that is, are we required to get a prescription for that patient to get the vaccine from us? Can we enter into a protocol agreement with a physician or another provider that gives us the authority, as long as we're within the CDC guidelines, to administer it to a patient without a prescription? Or some states actually give pharmacists prescribing authority to make that decision in this particular area. And in Georgia, we've actually had some pretty significant changes just in the time that I've been in school and been in practice. So when I was in school, the only vaccine that pharmacists could administer in our state without a prescription was the flu vaccine. This has changed. This changed significantly for the first time in 2015 when a bill was passed that allowed pharmacists to administer flu, meningococcal, pneumococcal, and shingles vaccines under a protocol agreement. So as long as we had that agreement with a physician, we had the authority to administer those without a prescription. As far as the age limits, we could go down to age 13 for flu. The others that are listed, it was age 18. We could still provide other vaccines, but again, it would require that step of obtaining a prescription to do so. Next slide, please. So this has changed again in the last couple of years. So I'm sure everyone has at least heard of something called the PrEP Act. There have been several amendments to it, but one of the big things it did for my profession was it gave us more authority, especially in the area of immunizations. So under the PrEP Act, we got the authority to order and administer ACIP or CDC recommended vaccines to patients ages 3 to 18. So that came about because, especially in the early days of the pandemic, when things were shut down, a lot of people were not accessing primary care. So they weren't going to their regular pediatrician visits like they were before. And there was this big concern about routine vaccination rates dropping. So part of the solution was, let's increase the places where people can access vaccines. There were some other amendments that gave us additional authorities, like administering the COVID vaccine as well. But one thing to keep in mind, while this federal law superseded the state law, it's tied to the COVID-19 public health emergency. So once we're out of that emergency, we fall back to state law. The public health emergency was recently continued. I believe it was just last week, but that very well could be the last time that it does get renewed. So very likely we will soon be going back to state law. The good news is a lot of states actually use that as an opportunity to look at their current state law, especially when it comes to pharmacist authority, and kind of said, well, they're already doing a lot of this. Maybe we should just make it permanent. So in our state, the legislation that was passed in 2021 stated that a pharmacist may administer ACIP recommended vaccines to adults 18 and older. So it wasn't limited to a specific list. If it's on that list that's recommended by the CDC, we could do so under a protocol agreement for adult patients. And then it goes down to 13 for influenza vaccine. And the way it's stated is illness resulting in a public health emergency. So things like COVID, or if there's another pandemic, they don't necessarily have to edit the state law to give us the authority to jump in with that particular vaccine. If you'll go to the next slide. I did want to take a look, I don't know how well you can see this graphic, but I pulled this from an organization called NASPA that looks at pharmacy laws across the nation, because I wanted you to see kind of how we stack up. And the darker blue colors kind of indicate more authority. So you can see actually in a lot of the states in the United States, pharmacists have additional authority to give immunizations to children aged 7 to 18 years old, either by having their own prescribing authority or by entering into one of those protocol agreements. So in a lot of other areas, you will see pharmacists more actively involved in vaccinations for pediatric and adolescent patients. In Georgia, we fall into this middle category, this kind of light blue, because again, we can go down to 13 for things like flu and COVID, but everything else, it's 18 and older unless we have a prescription. One of the things I did want to point out is the state of Iowa, which is the same color as we are. They actually, one of their exceptions to the 18 and up rule is actually HPV. So a pharmacist in that state can administer the HPV vaccine without a prescription to patients 11 and older. Next slide, please. So kind of what does this all mean? I know I went kind of fast and put out a lot of information. So just to kind of summarize what we're able to do and kind of what our role is. So we now in the state of Georgia have the ability to administer the HPV vaccine without a prescription to those who are 18 and older under our state law. Again, it's currently lower under the PrEP Act, but that will eventually go away. I'm hopeful that we'll continue to revise our state laws to allow us to take more and more of an active role. But even if we're not the primary people administering this vaccine, there's still a lot that we can do. So we also have access to something called GRITS, which is our state registry that has the record of all vaccines administered in the state of Georgia. So anytime you go to a pharmacist, they have access to that portal and they're going to enter the vaccine that they give to you in that portal. And because of these expanded authorities that we've gotten, a lot of pharmacists have made an effort to make that a more regular part of their workflow. So if someone presents for, say, a flu vaccine or a COVID booster, a lot of them are now kind of taking time to say, okay, let's look at this profile as a whole. Are there any gaps? And so if they see that someone didn't get the HPV vaccine, they can actually educate the patient and say, hey, has anyone ever talked to you about this vaccine or why it might benefit you? And depending on the patient, they might be able to go ahead and give that vaccine, or if nothing else, they may be able to obtain a prescription or refer them somewhere where they would be able to get it. Also, if a patient, is at a physician's office and is like, oh, I meant to ask about this vaccine, I forgot. If they're going to the pharmacy afterwards, your pharmacist can actually look up that information for you as well. Another thing I wanted to mention is, we do have that group that starts the series but doesn't finish the series, and pharmacy can be a great resource for that as well. So if one of the barriers is getting back in for an office visit, then maybe the patient could get the second and or third dose from a pharmacy instead, especially if part of the issue is having to take off school or work. Because we're usually open more extended hours. So that's another thing that I wanted to make a plug for. So really in summary, and actually you're welcome to go to the next slide if you'd like. So really, I just hope that this gave you a little bit of thought, because this is an area we definitely want to make an impact in. And actually, I've had a few students go out with Janet and do some screenings and help identify patients who are eligible for the HPV vaccine. So I just encourage you to reach out to your pharmacist if you have any questions. If they're not able to help you, they can probably get to you to somewhere that can help you. So I don't know if I have time for questions, but if I do, I'm happy to entertain them.
So if the HPV, is that going to be a cost? Because obviously, in rural areas, maybe that is just like our survivors. So do they have to have a cost? Will they pay for that?
Okay, so if the patient is insured, part of the Affordable Care Act required that all insurance covered the cost of it. So if the patient has insurance, it should be available at no cost. There would be a cost if they were uninsured, though. Good question.
Pharmacy and I are best and first name basis.
Good, I'm glad. Thank you. Hold on, my microphone's stuck.
Point out the numbers of the biggest improvement is starting at 9, the vaccination. I know the ACIP recommends 11 to 12. Originally, the only reason is because that's the time they're coming for tetanus, whooping cough, meningitis. It was expected. But in reality, now best practice is to start them at 9.
Yeah, and in speaking with some pediatricians, I know several of them work, because also the further you go, the less often it seems like kids go to the doctor. Oh, I'm sorry, did I use this? Oh, sorry. There was a comment in the crowd about kind of the trend to start the HPV vaccination earlier, closer to the age of 9. And in talking with some pediatricians, I know that definitely is their preference, because I think the younger they are, the more likely you are to kind of catch them and finish the series. Because as we kind of get older, we tend to see the doctor less and less. So yeah, so as far as like pharmacy law usually kind of pigeonholes us into the ACIP recommendations. So I know, and I mentioned Iowa as an example, if they want to go at the age of 9, they do need a prescription, but they can do it on their own at 11. But yeah, I know that that's a common trend to kind of increase those rates, is giving it younger.
Thank you so much, Dr. Hannings. So that was great. I love how we're just increasing different points of access for patients to be able to receive these vaccines, and partnership with pharmacists, dentists, all the people who, all the practitioners who see our patients just need to be aware that this vaccine is available and remind the patients they see to get it. So thank you for your talk. And so next up, we have Miss Triana Arnold-James, who is really the creator and the founder of our Georgia Cervical Cancer Awareness Day. She started this 9 years ago, coming to the Capitol and advocating for better funding, for more access, for awareness and knowledge about cervical cancer in Georgia. And so we are just thrilled that she is here. And I neglected to mention earlier that she is also the founder of the Susan Jolly Foundation, which is also a sponsor of this event as well. So I apologize for that omission, but we are happy to have you here today.
Thank you. No worries at all. Let me see if I clip it here. I think that'll be good. Okay. Good afternoon, everyone. Wow. The funny thing about grief is grief never goes away. Just time allows grief to make it easier, make things easier. Susan was one of my best friends, and we raised our kids together. We raised each other. She was an amazing person. I promise you, everyone in this room would have loved her just the way she was. She was a busybody, which brings me to where we are today. Susan gained her wings because of cervical cancer. But the bigger picture also, and Dr. Baker touched on all of my points. And I was like, I don't even need to talk. Because Georgia did not expand Medicaid. And had Georgia expanded Medicaid, she would have gotten an early diagnosis and she would have gotten proper care, which is what she was doing. What a lot of Georgians were doing is going to the emergency room. The emergency room was her primary care. And as going to the emergency room, she was getting all kind of diagnoses. Her back, kidney stone, gallstones, everything except cervical cancer. And I was laughing at when someone mentioned kidney stone, because I almost got arrested at kidney stone, which is not unusual. So, because if you know me, because I refused to leave. I refused to leave that hospital. She called me one day and she was like, Triana, I just don't know what to do. They're not telling me anything. And I've gone to all of these emergency rooms. They're telling me this, they're telling me that. And I beelined it up to Kenneth Stone and I said, guess what? I'm not leaving until someone tell her exactly what's going on. There are times as women, men too, but as women, we have to be our own advocate. And if we're not, and of course, I'm a woman of color, Black woman, and some medical professionals don't believe that we feel pain, that we don't have issues. And I have to even tell my primary care, look, I'm not going to be your guinea pig. This is what's going on, and this is what you need to do. Thanks to WebMD. So, okay. I'm telling you. But I am a kidder, so this is who I am. And so it was a Wednesday in August. I'll never forget that day in 2014. And they said that it was an oncologist at the emergency room. And I don't know, it was a divine God, all of that. And so he said that she could come to his office. He ran the test, and a lot of the tests that when you're having all of these issues. And so by Friday, he gave us a call and he says, I'm not certain, but it looks like cervical cancer. And he said it was stage 4. So, and then 5.5 months later, ironically, during Cervical Cancer Awareness Month, January 8th, 2015, she passed away. And out of my anger, turning my pain into purpose, she passed away January 8th, January the 11th. I started the Susan Jolly Awareness Program. And that's bringing the prevention, the impact of cervical cancer. And I want to thank a few people. Stacey Evans, Representative Stacey Evans started it. She was my representative at the time. And I went to her and my city councils and I was like, what can we do? We got to do something, you know. And so they were giving me proclamations. They was allowing me to tie a teal ribbon around the trees and everything. And so then we brought it to the state capitol. And yes, I am a thorn. I wear that crown proudly. I get on people's nerves, but you know, I have to. It's important that we advocate for these issues, and I'll tell you why. So after Stacey Evans, then Terry Anulowicz, Representative Anulowicz, picked up the reign and has been down with this ever since. And then there was Tamira Moon, who helped me to bridge the gap with the Cancer Consortium. And then she got promoted. And then Jenna came along. And then Dr. Boyce and Bella and Dr. Rodriguez. And you know, just thank you all so much. Thank you all for your commitment. Because I believe that we can save lives. I really do. I want my best friend back. I don't want to be standing here in teal. You know, I would rather have her. But I know that God doesn't make mistakes. So here's what we have to do. We have to keep this going. And we have grown, y'all, from where I started this 9 years ago. And now we have a congressional bill. It passed the House. It's HR 1550 in Washington, D.C. And Representative Castor is the one who co-sponsored. It's a bipartisan bill in D.C. So we've went from city to county to state. Now we're in D.C. So here's what I need you all to do. It's in the, it's HR 1550. If you go to congress.gov, you can look it up and read the bill. Get on the phone with your senators and tell them to call it to the floor for a vote. That's what we need to do. Because then it's voted on, it will pass the Senate because it's a bipartisan bill. And then President Biden, before he gets out of office, can sign it. And then we can save lives. We can save more lives. I believe that everything that we're doing is we're saving lives. And I wouldn't be here if it wasn't for my OBGYN and Susan and this wonderful woman right here, Cheryl. Susan brought us together. And we've been hip and hip ever since. And so that's what we need to do. Thank you all so much for coming. We'll be doing this again next year. Throughout the year, some of you all, if I get your contact information, I'll be bugging you. Yes, I won't spam you, but I'll be bugging you because we got to keep this going. We got work to do. With the work that we're doing here and across the state, and I don't just do this during Cervical Cancer Awareness Month. I travel to different clinics and talk to people about HPV vaccine, getting the vaccine in the arms of young people. Now, my generation, you know, it is what it is. You know, we didn't have a vaccine, but we do have the opportunity for our daughters and our granddaughters. I have 4 girls, 8 boys, and all of them have the HPV vaccine. No matter what, this is what we got to do. So with that being said, thank you all so much. I think I don't have anything else to say. I'm sorry. I do have one more thing. And Dr. Baker touched on it. The disparities. The difference between me and Susan is that I'm a veteran. She was uninsured. Had she been a veteran, she would have gotten the same care that I got. So we got to also encourage the legislature. The Medicaid waivers, they okay, but we got to expand Medicaid in the state of Georgia. Okay, thank you all so much. Let me back up. Oh, and everyone online, thank you all so much.
Absolutely. Thank you so much, Triana. It's good, like the late Representative John Lewis said, to create a little good trouble every now and then. And this is something that definitely warrants that. So again, like Triana said, we need everybody's help. This is something that we all should participate in. And so, you know, wrapping up our program here today, these are our calls to action and ways in which you can assist us in driving these HPV vaccination rates up and eradicating and eliminating cervical cancer here in Georgia and the United States and across the world. So in the healthcare system, and providers can increase access to both HPV vaccination and cervical cancer screenings. You can provide accurate information on HPV vaccination and cancer prevention, engage dental providers and pharmacists to help prevent HPV-related cancers, work to address the shortage of OBGYNs in Georgia, like Dr. Baker had mentioned, offer education on HPV vaccination and cancer prevention, and then to support the federal Prevent HPV Cancers Act. That's what Triana had mentioned. That's HR 1550. Call your senators, get it out of committee, get it to a vote on the Senate floor. For parents and caregivers, you can check in with your healthcare provider to see if your child is up to date on the HPV vaccination. Bella, one of our subcommittee leads, did a great job reaching out to communities, and many people did not know if they were vaccinated for HPV or not. You have to ask and find out. Adults up to age 26, you can check with your healthcare provider and pharmacist to see if you have completed your HPV vaccination series. And then again, adults from 27 to 45 years old, talk with your healthcare provider or pharmacist to determine if you would benefit from receiving the HPV vaccination series. You'll benefit from it. So again, thank you everybody. Thank you for this wonderful day. Thank you to our speakers, especially for all the great information that you've provided. If you would like to figure out more about how you can join our work group, how you can help, how you can move all these initiatives forward, you can contact Andre Vassi. He is the coordinator for our group for the HPV cancer-free GA. Here's all of our contact mechanism, ways to contact us. And then a huge thanks again to the Georgia DPH, our speakers, Georgia Cancer Control Consortium, HPV Work Group Policy and Advocacy Subcommittee leads, Triana, Representative Anulowicz, all of our sponsors that made this event happen today. We appreciate it. And then there is the QR code for our online participants to fill out the survey. Again, be sure to fill out part 2 if you are planning on getting continuing education credit. So thank you all again, and we're looking forward to seeing you again next year. Oh, and if for everybody who's here in person, we are going to be taking a photo out on the Capitol steps right after this. Great, and yes, that was with Anna Reek, one of our work group members.
And the surveys are outside too. If you're looking for CE credit, we have paper or you take the QR code. Make sure you turn those into us outside of the table. And we give you.
Thank you, Triana.
Thank you.
Great to have you. That's all that you do. You get me fired up more than anything we've done.